For decades, America has tried to combat the harms of drug use primarily through banning drugs and incarcerating people who use them. But this has caused a violent underground market for drugs, increasing crime in our communities. It's caused contaminated substances, increasing overdose deaths, and it's caused incarceration to skyrocket, destabilizing families. What we're doing isn't working. Crime, death, and broken families are the collateral damage of using the criminal justice system to address the public health issue of drugs. If you're looking for a better path forward, you're in the right place. What if we changed our drug policies to prioritize life, health, harm reduction, and thriving? And what if it benefited all of us? Our criminal justice approach to drugs had a beginning, and it can have an end. Join us on the journey to end it for good. I'm Christina Dent, your host, and if you're new here, End It For Good is a nonprofit started in 2019, based in Mississippi, that invites people to support approaches to drugs that prioritize life and the opportunity to thrive. This podcast is one of the ways we do that. You can head over to episode 34 to hear my story as a conservative Christian foster mom, changing my own mind on the best path forward with drugs, and then come on back and dive in deeper. I didn't change my mind overnight, and most other people don't either. We all need time to learn, think, ask questions, and explore. Whatever your perspective is, I'm glad you're here. Let's journey together. Welcome back to the End It For Good podcast. I'm Christina Dent, your host. We are in episode 105 today. Very excited here with Sam Chapman today. And before we dive in with him, just want to invite you to consider whether or not the work of End It For Good podcast, the other work that we do, has been of value to you. And if it has, head on over to enditforgood.com/donate. We're a 501c3 nonprofit. We do everything we do because of donations from people like you. So we'd invite you to partner with us there. It's super exciting to hear just the different ways that people have been impacted by the work, different aspects of the work. And part of the way that we're able to do things like go speak different places is not always because those places are lucrative to speak at. Sometimes it is that we know that an audience is really important for us to be able to reach. And even though we end up paying to take that speaking engagement, we pay the travel cost. It's important because it might help us to reach an audience who wouldn't normally hear a message about health-centered approaches to drugs and addiction. And your gifts allow us to do that, which is really important. So Sam knows a little bit about the nonprofit space as well from his work. We'll get into that. So let's just dive in. My guest today is Sam Chapman. He is the founder and executive director of the Center for Psychedelic Policy. He also runs Toolbox Strategies, which is a political consulting practice that specializes in state-level policy, strategy, campaign management, fundraising. And he has done a lot of speaking to legislators, lawmakers, decision makers. He's given over 150 presentations on psychedelic policy. He's originally from Maryland. He's lived in Oregon for the last 30 years and enjoys surfing on the Oregon coast, which he lives very close to, shucking oysters with family and friends. I don't know anything about shucking oysters. I have actually attempted to surf off the Oregon coast when I was in high school. I tried surfing again last year, and surfing at 41 is a little different than, surfing when you're 16,
Sure.
17. So there was no remote chance of getting up on that board last year, but it was fun trying, and it was fun back in high school. The Oregon coast is absolutely beautiful. Me and my parents ended up driving kind of the whole way down from Washington all the way through the state. So, yeah. So welcome, Sam. Welcome to the show.
Yeah, well, thanks so much for having me, Christine. It's a pleasure to be here.
I really wanted to have you on because we've talked a lot about psychedelic policy on the podcast. Over the last 2 years, we've had a lot of episodes on it. Here where I am in Mississippi, we've had movement and passage of psychedelic-related bills in our legislature this session. Those were just signed into law by the governor in the last 2 weeks from when we are recording. And so when I have talked to you in the past, you are one of the people who has just most helped me to kind of understand that policy landscape related to psychedelics, like not just kind of patchwork, but sort of the big picture, what's happening, what's working. And one thing I've really appreciated is your ability to be critical also of kind of the path. Here's what works, here's what hasn't. These are the things that have been really great. This is where we need to improve in the future, which can be hard. If you're in the advocacy world, you want everything to be amazing. You want everything you work on to be the best thing ever. And it can be hard to say, yeah, we need to tweak that the next go round. And so we'll talk a little bit about some of those changes. But I want to go back before we dive into kind of the landscape of psychedelic policy in the US, and specifically where it started in earnest with a psilocybin program in Oregon that you were deeply involved in and have been then deeply involved in helping it to roll out, be successful, and also being able to kind of speak into what's been successful about it. What are some of the challenges that it has seen? And people are interested now that they're hearing about psychedelics. They're like, what does this mean? Like, what would this actually look like in a community to have this available? And you live in Oregon, where it has now been up and running for several years now. So we're going to dive into what does that actually look like. But what drew you into drug policy work first, and then kind of how did psychedelics become a policy focus for you?
Sure, yeah. I'll try to give you the nutshell of my origin story here. So it actually starts in high school. In high school, I was very involved in different forms of leadership. I was sophomore class president. Senior year, I was ASB vice president, which essentially just meant that I ran all of the assemblies and did the morning and afternoon announcements every single day. And so I was a public figure. And I also was an organizer of fun, shall we say. I knew how to throw a good party in high school, and the administration knew that. And despite that, I still got good grades. I was one of 20 kids out of 100 that graduated that actually went to college from St. Helens High School here in Oregon. And the administration had it out for me. And on the last day of senior year in high school, I actually got busted for being intoxicated under the influence of cannabis on school property. It was very unfortunate, very frustrating, especially on the last day of senior year. And so I was brought down to the principal's office. They called my mom in from work, and they basically said, look, you have two options. One, get out of here right now. You don't get to walk with your class. You don't get to go to, the senior party. We never want to see you again, which I was generally okay with. I was ready to get out of there anyways. The second option was that I could go to a drug and alcohol counseling session because the administration thought that I had a serious drug problem. And my mom turned to me and said, I don't think you have a drug problem, but you're walking with your class and you're going to that counseling session. So I went to that session. I told the truth about everything. Yes, I had drank alcohol before. I had used cannabis from time to time. I got good grades, and I was one of the few people in my class going to college. And after 2 hours, the counselor looked up at me and smiled and said, Sam, I'm really sorry you had to come here today. There's nothing wrong with you. And I didn't know what that really meant until I got to college and went to the University of Oregon shortly after. And I discovered a group called Students for Sensible Drug Policy. And that organization had a fairly, I would say, libertarian approach to drug use. The philosophy was fairly simple. It says, look, regardless of what the laws may say, you have the physical ability to put whatever you want in your body. And so long as you are educated and not harming other people or yourself, you should have the right to do that. And I didn't really understand how much that resonated with me until I continued to learn more about the war on drugs, which turns out is not a war on drugs. It's a war on people. And specifically, it's a war on people of color. And it was then where I connected all of the dots. It was then where I realized my white privilege in this society. I got a slap on the wrist. I did not face the same consequences as my friends of color did when they got busted for cannabis. They got their college tuition taken away. They got sent to jail. They got probate. They got all these other things that I did not get. And when I realized that, and I found Students for Sensible Drug Policy, I said, I don't know if this is a career or if this is just a volunteer thing, but I'm going to do this. I'm going to figure out how I can leverage my privilege to undo the injustices of the war on drugs, aka the war on people of color. And so that's how I got involved in just general drug policy. So throughout college, I ran the SSDP chapter at the University of Oregon. I did everything from educational courses on what happens when you mix MDMA and alcohol together. Whether parents like that or not, that was happening every single weekend on campus. And a lot of kids didn't know that if you actually drink too much water while you're on MDMA and drinking alcohol, you can actually overdose faster, right? And so we actually teamed up with campus police to do that type of event. And then I also did lots of events around how to educate students on dealing with police encounters and know your rights and those types of things. And so it was through all of that that I was quickly connected with some medical cannabis activists. So my interest in the drug policy was first kind of harm reduction, know your rights. And then this was also right around the time where Oregon had a couple of different attempts to legalize medical cannabis in Oregon. And so that's where I got in touch with some terminally ill cancer patients who said, hey, you seem like someone who's young and energetic and like might be interested in helping us, move this next phase of medical cannabis policy. We'd like to license and regulate medical cannabis dispensaries so we can make it easier for folks to have access to this that need it. And so that was my entry into drug policy. It was right after I graduated college, the ripe age of 22, I co-authored my first law. That law was House Bill 3460. That was the law in Oregon that licensed and regulated medical cannabis dispensaries. From there, I had a consulting firm in which I helped businesses open around 50 different dispensaries across the state over a number of years. And I simultaneously helped cities and counties develop all of their time, place, and manner regulations. So both dive head first into both the entrepreneurial aspect of new business around Schedule I drugs, and also got a lot of really important experience standing at the middle of the intersection between the decision makers at the city and the county and the advocates who just wanted reasonable rules and regulations for their business. And so that, of course, evolved into adult use cannabis. And about after 7-8 years of doing cannabis advocacy, I just decided to kind of take a break and wait for the next thing to show up. And what do you know? It was psilocybin therapy's time. And that's when I became the campaign manager for Measure 109.
When you were talking and telling that story about your high school experience, it reminded me of a previous podcast episode that we did. I believe this one was with Terry Blevins, the first time he was on our podcast. So for people that are thinking, yeah, but like most people would get the same treatment that Sam got, Terry tells the story of he was a police officer and the kind of moment that he goes back to when he began to think something is wrong here is when they pulled over an African-American young man who had just graduated high school, was going to college, full ride scholarship, never been in trouble with the law before. And he and his partner arrested him for having a joint in the car. And he said, he said that the guy is just weeping, my future is going to be gone with this. And so that's a real thing to grapple with. It doesn't only happen to African-American people. It isn't that every white person gets off and but we can look at the statistics. We know this is true, that there's more enforcement in the African-American community. And so there are real lifelong altered trajectories that can come from that. And so that just brought me back to that. So you worked in medical marijuana for a while, took a break from that. And then was there a moment where you saw this opportunity with psychedelic policy and kind of drew you back in after taking a break from this world?
Yeah, I mean, it's funny. I would frame it as the opportunity found me. And that's the funny thing about what I've learned over my years, my entire adult, life, I have been involved in some type of progressive drug policy reform, movement or project. And I've really come to realize that the more that if I'm transitioning, letting the thing find me as opposed to trying to force something to happen always is the better choice. And so I was just kind of taking a break. I was about, a year out of the cannabis effort, which I was very proud of, but it turned more into kind of a business framework, which is a lot further away than where I started and why I got involved in it to like support, medical, terminally ill cancer patients, basically. And so I went to a soiree. I went to a party of advocates, of psychedelic advocates, that was at the house of Tom and the late Cherie Eckert. And a lot of my drug policy friends were there. That's actually how I got the invite. And I got to meet Tom and Cherie, and I got to learn about their vision for a psilocybin therapy program here in Oregon. They were both, therapists that, were happy with that work, but knew that there was more tools in the toolbox that they wanted to be able to legally use and to really open up that opportunity for so many people to use those tools and leverage those tools for better outcomes than we were seeing with, the current modalities through talk therapy and otherwise. And so I got to meet them, and very quickly, the campaign kind of kicked off, basically because David Bronner said, we believe in this and we want to fund it, right? Like that he's been a big catalyst throughout the country on psychedelic policy in many different policy areas. And that was when I was approached to be the campaign manager for Measure 109. My experience in medical and adult use cannabis, my ability to kind of lead a team through a very thick and, likely has never been done before type of project, really stood out. And so pretty quickly after meeting them and after finding out that this was going to be a real campaign, I was brought on to the team to help manage the campaign.
And you mentioned David Bronner's name. For people who aren't familiar with him, you likely have heard somewhere of Dr. Bronner's soaps.
That's right. You have some in your shower, in your kitchen. It's around, right? It's around, yeah.
Right. And it's another just a point. I'll go back to my donation thing. The reason things happen in the world is because people believe in them and invest in them.
That's right.
So you might not have a Dr. Bronner's, portfolio of business that you've got to donate from, but this is how things happen. This is how change happens. As people get passionate about something, and whatever it is that they give, they decide to invest. Hey, I believe in this thing. I'm going to invest in that thing, and that is how change happens. That's how India for Good has been able to celebrate 6-7 years now, is because people continue to say, yes, I believe this work is important. And so that's, I think people just think sometimes these things are sort of destiny. They just sort of happen on their own. They don't happen on their own.
Most things don't fund themselves, especially these days.
They don't fund themselves. No, they don't fund themselves. You got to work at it.
That's right.
So 2020 is when Measure 109 passes. And interestingly, so for people who are in the American South, other places also, this is just where I happen to live, so I'm more familiar with how people think about Oregon. What they think about in 2020 related to Oregon is decriminalization of all drugs in terms of possession. Most people think everything was legalized. That's not what happened. Decriminalizing of the crime of possession was made not a crime anymore, and that eventually got rolled back.
Yes. What
they don't realize is that same cycle, this psilocybin therapy program was passed, and they've probably never heard a peep about it.
Right.
They probably don't even know it exists. That's how sort of uncontroversial it has been back this way. And for people kind of love to haul out Oregon as an example of all the things that are wrong in drug policy. And yet we've got this psilocybin therapy program that is fascinatingly uncontroversial.
Yep.
Not that everybody loves it, but it has not been the thing that has been, it hasn't gained national prominence one way or the other. It has sort of just quietly been rolling, serving thousands and thousands of people. And we're going to get into that and kind of what that looks like on the ground. But what made that politically viable when similar efforts hadn't succeeded before? Because basically it's taking kind of the approach of cannabis, which is it is federally still illegal. It's still federally a Schedule I drug.
Yes.
And yet with cannabis, states have said, we're going to legalize it anyway. And the feds have generally kind of stayed out of that and let states run their own programs.
Right.
This was another attempt at that kind of same thing. Psilocybin is not federally legal. And yet Oregon was saying, hey, we actually think we want to make it legal inside of Oregon. What was the catalyst that made that possible?
Yeah. Well, I love this question because it always gives me an opportunity to give a very unique, but I think on point perspective of the difference, the similarities, but more importantly, the differences in stigma between cannabis and psychedelics. if you ask a random person walking down the street, how they feel about cannabis, they've got a strong opinion in one way or another, right? If you ask someone walking down the street how they feel about psilocybin, 9 out of 10 people would say, it's still a what? They're not even sure what you just said, right? And so that was one major aspect of an advantage that we had with psilocybin, is that we were starting from a place of zero education, which from a political perspective is always a better choice than trying to move someone from that is already holding an opinion very tightly. That takes a lot more effort, a lot more money, and a lot more time. And there's still no guarantee you're going to get them to unclench their fist on their opinion, right? So that's one thing. The other thing is the historical stigma that I mentioned. Why was cannabis made illegal? Well, it was made illegal to put people of color in jail and fund the prison industrial complex. Why were psychedelics made illegal? Mostly to stop hippies from protesting Vietnam. Very different reasons, right? And so those stigmas have grown and incorporated themselves into society in very different ways, right? But as you said, both Schedule I drugs, both from a federal perspective are the same, right? We know they're definitely not. But the other aspect of that, and I think what kind of backs up the point that these stigmas are so different, is that we saw an explosion in federal interest and research around psychedelics, and really around psilocybin, which continues to be the leading psychedelic that has the vast majority of research behind it at the federal level. Another thing that we had going for us during the campaign is that despite this being federally illegal, we could point to the fact that the federal government had given psilocybin a breakthrough therapy designation, which not only contradicts the Schedule I definition of this has no medical value, it has so much potential medical value that it might be above and beyond everything else that is legally available right now. Whenever we ran into someone on the campaign that said, well, I'm not so sure about this value thing, like, what does the federal government say about it? It was like, well, actually, they're contradicting themselves. And they're actually saying that, this is very worth exploration. And that's really all we had to point to when people had questions about the science, right? Which is ironic, which is that we pointed them to the federal government. So it came full circle, which for Oregonians is like, of course we've been lied to about this. Like there's all kinds of things that we feel pretty confident we've been lied to about from the federal government over the years, right? And so that was just another one of those things. And so at that point, it wasn't really a question of, moving people from one place or another. It was slightly nudging them onto the side of the fence that we wanted them to be on, which was a yes. And so the way that we did that was very straightforward. I mean, when we initially started polling on Measure 109, and we just asked people the questions, here's what it is. Are you a yes or a no vote? 39% of Oregonians said yes. When we fed them both pro and con messaging after that, and then asked them how did they vote, and the questions that we gave them on the pro side were, we answered 4 easy questions. 1, what is psilocybin? 2, how does it work? 3, what exactly are we doing? Like, we're setting up a regulated program, not retail, right? It was almost just as important, if not more important, for what I call the soccer moms and grandparents, which are the people you really need to convince to pass anything, that this is not retail cannabis. We're not talking about selling mushrooms at 7-Eleven, right? That was very important. Sometimes to say first before anything else. And fourth, but certainly not least, is we all know someone who stands to benefit. We all know someone, if not ourselves, that's struggling with severe depression, anxiety, PTSD. I mean, you name it, right? Like, we can all step into that person's shoes. And the question becomes, do you want to give them another tool? Because what's working right now might be working for some, but everyone can agree it's not working for everyone by a long shot. And so why would we not add a new promising tool to the toolbox? That 39% turned into 60 in about 5 minutes. And that's how we knew we had a ball game on our hands. That was the power of starting from a place of zero education and boiling it down to very basic, straightforward questions, right? I mean, the attention span of anyone is shorter than it's ever been in today's current environment, and even more so when people are thinking about how to make a political decision or a vote, right? I mean, you've got about 90 total seconds, unless someone's actually interested and does their own research, to help them understand why they should vote yes or no on something. And that was the equation. That was the playbook as it relates to educating the voters. And it was overly simplistic and very intentionally so.
And one of the things I've always loved about doing this work is I don't feel like I have to put spin on anything.
Right.
I'm not good at spin anyway. This would not be for me if that was necessary. But just I feel like what we're doing is trying to get people, we're not trying to get them to stop thinking and just agree. We're trying to get them to sort of slow down long enough to think and to say, hey, look at what's actually happening, and look at why it's happening, and look at some of the other solutions and options out there. And you don't have to do a lot of arm twisting. I don't think arm twisting works. People own their own minds. They are going to think whatever they want to think, no matter how passionate you are. So for us, it has always been about how can we create spaces where people can just come and learn. Not everyone's going to end up agreeing with what we think is the best solutions. But a lot of people just don't have a space to kind of slow down and learn for a minute. And, they've just been told, be afraid, this is all terrible. And when they have a chance to kind of engage honestly and they feel respected, it's often the most time they've spent thinking about potential other solutions in their life. And that's just because all of us we don't have time to think about all of the complexities of the world until they come to impact us. So explain to us what the program is like in Oregon. And like like Christina is coming to Oregon for psilocybin treatment. Like, what happens to me? Where do I go? How long does this take? How much does it cost? What does the program actually look like in reality?
Totally. Well, before you even decide to come, there's a couple of things you should do. Primarily answer the first question, is psilocybin potentially right for me? It is not for everyone. Let me be very, very clear, right? We are still in what, to me, at this point, feels like a never-ending hype cycle of psychedelics are the cure-all. Nothing could be further from the truth. They are one of the most powerful tools of potential that we have had in recent history within the legal regulated context. Let me also be clear that these tools have been tools for thousands of years, and we are just attempting to try and put them into a framework into our healthcare framework without replicating the broken parts of that framework that exist already, right? What a challenge. And so Oregon's program allows anyone over the age of 21 to go through a screening process, right? And that screening process essentially says, there's a couple of things that are no-go. If you are actively psychotic, you cannot have access to psilocybin therapy in Oregon. If you are actively suicidal, you cannot have access to psilocybin. So there are a couple of hard no's. And then there's a whole category of, I have severe PTSD. I have some pretty serious mental health conditions. Those are not disqualifications, but that does mean that you may be triaged to a specific facilitator, a licensed facilitator who's received training through different programs to be your psilocybin facilitator. There are specialists, right? So you might need to go to a specialist that has that type of background, right? You could imagine a veteran who's done, 30 deployments of active war might want to sit with another veteran who has been trained to do this, right? So there's a lot of opportunity for matchmaking between the client and the facilitator, which is absolutely essential, right? And so during that process, they're doing an intake to really determine, one, is psilocybin right for you? Potentially, yes or no. Two, tell us more about your health history, right? And at that point, the facilitator and the client get to kind of make that decision like, okay, we're ready to move forward. Let's start to talk about what the actual session looks like, right? And so all of that is in phase one. That's called preparation. And there is a minimum amount of time in which that has to happen. But a lot of people do 2, 3, 5, 10 preparation sessions. It's different for every single person. Some people have experience before. Some people have literally, they just heard about it last week, right? But they're desperate to try something new. And so you got to really meet people where they're at. That's the preparation phase. Moving into administration. Administration is done.
And real quick, before you start administration.
Yeah.
So preparation. So some people, if they're coming, let's say from out of state, they might be doing those sessions virtually with their facilitator before they actually travel to Oregon to do the treatment.
You do not have to do the preparation in person in Oregon. You can be literally anywhere in the world. And if it's not also clear by that statement, you do not have to be an Oregon resident in order to come to Oregon and receive and participate in the psilocybin therapy program.
Got it.
Yep.
All right, on to. So we've gone through preparation.
Yep. And so on to administration. This is the actual day in which you would arrive at a licensed service center. So again, this entire program is built on a foundation of licensed and regulated individuals and businesses. So you have facilitators, you have service centers. These are the places where you actually go and consume the medicine, and you're under the supervision of the facilitator from start to finish. And then you also have producers and testing facilities, in addition to training programs. So those are different entities. I probably should have said that at the top, but just for the context. So for the administration, you will go to a licensed service center. I believe there's around 25 to 30 of them throughout the state. That number fluctuates for different reasons, but the majority of them, I would say, are probably in Portland right now for obvious reasons. It's the biggest city in the state. And you will show up to your administration session. You'll confirm what you've already talked with your facilitator about what dose you're interested in, right? Some people just want to try a lower dose, 5, 10 milligrams, right? Some people, more in the middle of the road, 25, 30, that starts to get into the higher range. The max amount of psilocybin that you can take in one session is 50 milligrams. That is often what is described as a heroic dose. That is essentially equivalent to 4 to 5 plus grams of mushrooms. I like to try and convert it to people because if you have any experience with psilocybin or drugs in general, you're often not counting milligrams, you're counting grams, right? So that is a big experience. And again, a lot of people need to go to higher doses. It seems pretty evident, at least anecdotally, that people who have been on a lifetime of SSRIs, for example, may need to go to a higher dose in order to, quote, break through and actually receive the full effects, right? And again, this is something that no one's making this decision on their own. Some people are advised and work with dually licensed, both healthcare professionals that are also psilocybin facilitators. Those are the people that you should be looking to tell you whether or not you should stay on, lower your dose, go off your dose, right? Like these are not decisions you should be making on your own. And those specific decisions are also not decisions you should be making with a facilitator that does not also have a healthcare license in addition to a psilocybin facilitator license. So you'll be at the service center. Depending on what the dose is, it will determine the time, right, that you have to stay there. And at the end of the day, the facilitator gets to determine whether or not you're ready to go home. So that's a part of the deepening relationship. And it's also a requirement that you have to have someone come pick you up and drive you home. So you have to have your own ride home. You cannot pick up and leave and drive yourself straight out of the service center anytime you want. We wanted to make sure that we nipped that one in the bud, as there's a lot of misconceptions around this being like, well, this is just retail. People can do it and then drive off, and people would be driving while under the influence of mushroom. No, sorry. We saw that one coming. That one's built in the rules. Can't do that.
Yep. Okay. So people come, and is it, are we talking like a clinical facility? Like they're thinking doctor's office, white walls, a kind of hard bed with some crinkly paper, in there. Is it like that? Is it more like a therapist office? What is it like to be in one of these centers? Yeah.
So there is a spectrum. I would say that the majority of service centers are very like a therapist's office, with a couple of unique features, right? Some of the facilitators are also gifted musicians. A lot of people really enjoy live facilitation, live music to be played. Other people just enjoy their own kind of playlist. It's often always provided that you use eye shades, basically, kind of really helps you go inward and do this work. Most of them are similar to therapist offices. There are some that are a little bit more retreat based. Right. So that's from, they're out on acreage, and they figured out how to allow their service center to have outdoor facilities for people to go outside. There are not as many of those as I would like to see, because I think there's a big inclination for people to be in touch with nature. I think that there's more room to work with some of those rules in the future to allow more experiences to happen in nature. But yeah, from the therapist to the retreat type of setting, there's a pretty big spectrum there. And that really depends on what type of environment you're looking for, what type of facilitators you're looking for, and also what your budget is, right? And I'm sure we'll get into this at some point, but, psilocybin is not yet covered by insurance or the state, which is certainly something that is a target for the future here. But for right now, it's out of pocket costs. And I'll go ahead and answer the question that maybe that you're going to have next is, what does this cost in Oregon? So there's a pretty big spectrum. I would say on the lower end, there are several service centers that offer individual sessions for $800. And that $800 is out of pocket. That covers preparation, administration, and one integration session, which I'll explain here in a minute. And then you have, more middle of the road, around $1,500 provides the same things. And then you have some of the retreat models that are clearly for folks who are more affluent. We've seen everything up to $3,000 to $5,000, and you're basically at an all-inclusive resort at that point, or they're taking you to one if it's not at the service center itself.
Yeah. Okay. And how many people have done this in Oregon over the last couple of years that it has been open, and how has it gone?
Yep.
Have we just not heard of the disaster that it has been, or what's happened with all of the people who've gone through?
Yeah, no disaster, and we've got data to point to on that. So, the program's been up and running for about 3 years now, and somewhere between 19 and 20,000 people have gone through the Oregon program. Wow. Of those 19 to 20,000, I believe there's been less than 20 emergency calls for like serious adverse events. And so that's like a 0.01 something in terms of serious adverse events, right? Where like you have to call 911 because someone is having such an issue, whether it's a medical issue or, they're physically trying to leave, that kind of thing, which does happen from time to time. But again, it's at an astronomically low rate. Like even the advocates are kind of surprised how low that rate. And it just speaks to how serious we took safety in this program. I think there's a lot of, both advocates and people outside the psychedelic community that are like, this is, we can't over-regulate the safety side. Well, out of the gate, I think actually we can and we should, because we don't know what numbers we're going to see. And now that we've seen this impeccable safety record, I think we can actually start to look at, okay, like we now know where the baseline is. We're doing really good. How can we continue to withhold that safety record and open up other parts of regulations that will make this experience better, better outcomes, more access financially and otherwise, a lot of opportunities to work from based on where we're started here.
So that's one of the things that's gone better than expected in terms of just the safety profile of that's a really low rate of adverse experience, events. And I think people tend to, with something new, if anything bad happens, people are kind of, the knee jerk is like, but look, someone got hurt.
Right.
But you look at any pharmaceutical, there's all kinds of negative potential side effects. You just need to watch late night TV for like 20 minutes and you'll see all of these FDA approved pharmaceuticals that people can take for a whole host of conditions that all have, hey, if these terrible things start happening to you, get emergency treatment, or these are potential side effects. And that's not the way that we approach tools to help with medical problems. We absorb risk always. There's just nothing that doesn't come with any kind of potential side effect. So we're not looking for zero risk options. We're saying, hey, did these tools help more people? Is it a tool in the tool belt that we need that does not have significantly high risk, where it really is not worth the risk of somebody taking it, because the risk of an adverse event is so high. And when you've got 19,000 people that have gone through, and you've had 20 emergency calls, that is next to nothing in terms of just how many people are going through it with no adverse effects. So that's a positive. What are some of the more challenging things? What grates at you from the last couple of years you've seen it implemented? What are the things that you're like, oh man, this is not what I wanted, or I wish this was different?
Yeah, I mean, the big and the obvious one, the one that anyone who has read any news about the Oregon psilocybin program over the last couple of years is the cost, right? I mean, even at $800, that's money most people do not have, even if you've got a full-time job and you're doing all these things. Like, in today's environment, that's not an expense that's just extra dollars laying around for the average person, especially the person who likely needs it the most, that has a mental health condition that is uniquely positioned for psilocybin therapy to help address the root cause, not just the symptom, but the root cause of. Those people are still priced out, right? And the irony here is the opportunity. As the first state to move forward, we did not expect this to be cheap or free on day one, right? And that is now bringing the cost down is the biggest challenge. That is our biggest opportunity. And that's the challenge why I've decided I'm still doing this work. I took a year off about a year ago, just to take another break after the measure and 4 years of starting the nonprofit that started to help implement all these programs. And this is the number one reason why I came back. I want to finish the job. We have proven something historic that 5 years ago, every single person for the most part was laughing at us. Like, set up a licensed and regulated program, even though it's federally illegal, for psilocybin. What? No way. We've proven that, right? No federal intervention, incredible safety record. Almost 20,000 people have gone to the program, and incredible stories of healing, right? Now the question is, how can we get this in the hands of people who stand to benefit most? And what I've really spent my time on, and why I decided to launch the Center for Psychedelic Policy, is to address, one, how we've been talking about the question around cost and how we can change how we're talking about it, right? And I think it's very valid to talk about it from the client perspective. This is who's paying for it. At the end of the day, like, that's who's paying for it, right? But who should or could be paying for it, right? And that's when we start to get into questions around insurance coverage or Medicaid coverage. Or in Oregon, we have the Oregon Health Plan. That's basically the Medicaid coverage here in the state. And instead of thinking of it as something that's out of pocket, we should be looking at, what is the state currently investing in? How many tens of billions with a B, tens of billions of dollars is the state spending every year on modalities for treatment-resistant depression, alcohol use disorder, substance use disorder? What are the outcomes? How are those doing? Modest at best. They're definitely helping some people, but the outcomes are pretty predictable. They're not game changers necessarily, and they're getting more expensive. We have an opportunity to rethink who the target audience is for solving for this affordability problem. I think it's the state. I think it's the Oregon legislature, and every other legislature in the country that's considering a program actually has an opportunity to do what Oregon couldn't do, which is address affordability on day one instead of in hindsight. And I think we do that by asking a couple of simple questions. One, Can psilocybin be just as effective, if not more effective, than the current investments that the state is making in behavioral health? Yes or no? I'd bet a decent amount of philanthropic dollars the answer is yes. The second question is, what is the cost comparison of what they're currently investing in and what could be saved? Can psilocybin cost the same amount, if not a fraction of what we are currently spending? Yes or no? The answer is absolutely yes, right? And so the question becomes now, how do we collect the information to make that case, and how do we incentivize the state to make an investment in this? And that's currently what the Center for Psychedelic Policy is working on here in Oregon. We're starting to convene stakeholders from across the state, from clients to facilitators to service centers to the one testing lab we have in the state, to state agencies, to localities, to mental health professionals, CCOs, et cetera, and all bringing this together to say, we think we actually have an opportunity to ask the legislature, not for full coverage out of the gate. I'm not naive. Politics is a game of attrition here, but for a couple $1 million for a Medicaid pilot for the populations that are costing the state the most money with the least amount of ROI. I think if we pivot this into a health economics ROI argument, not only can we get this done here in Oregon, but that will actually be a blueprint for every other state that's currently thinking about starting a program, is to make that health economics case on day one and build in data mechanisms and tracking mechanisms for the outcomes to show, to prove that our theory is indeed the truth, that we can be more effective at a lower price point utilizing psilocybin therapy than some of the current behavioral health investments that are flatlining and getting more expensive. That's the goal here in Oregon. I hope that we can do it here and start to prove that point in other states as well.
I think you've just blown multiple minds thinking about Medicaid paying for psilocybin therapy, especially when you people are like, "What's psilocybin?" And I'm like, "It's magic mushrooms," is what we kind of which you probably heard it called. Everyone's like, "Oh, magic mushrooms, yeah." But I think I love that dream, that vision for it, because most of us aren't thinking about, we just think of these things in totally separate categories. We think like pharmaceuticals that insurance and Medicaid pay for, and then all these other experimental things that are kind of a separate, completely different set of tools. And it's, why on earth would insurance or Medicaid ever pay for those things? Well, why wouldn't they, particularly if it would save the state money, but even if it just offered another tool, let's say the cost was equal, which it's not equal, because it is, many of the tools that we have for lots of these mental health conditions are lifelong tools. It's not like you take an SSRI for a year for depression and you're cured of the depression. Like they're kind of meant to be long-term
treating
tools
symptoms,
for a
not
lot
root
of people.
causes, right?
Right. Yeah. And so when you introduce something like psychedelic assisted therapy, which is can be a one-time event that helps that person overcome and not struggle anymore. I have a friend who, takes it about once a year, but doesn't have to take any other medication in between. It is the thing that helps him to reset every year and come out of that deep depression as he begins to kind of slide back into that. So I think we've got to help our brains to open up these categories that, wait a second, maybe there are tools that don't just treat the symptoms, that could actually treat some of the root causes. And gosh, if we could pay, let's say on the high end, let's say we paid $3,000. What is that, like one ER visit for one person?
Yeah.
I mean, we are paying massive amounts of money for, as you said, the people who, the vast majority of healthcare costs are a very small group of people who incur those costs. The majority of people who are generally healthy are a drop in the bucket of all the healthcare costs in the country. It tends to be a pretty small group of people that incur the vast majority of all costs. So even if, as you said, you're just looking at that group saying, hey, the people who are actively, for whom the current tools aren't working well, and it's costing the state lots of money to use tools that aren't working well for them. Let's try something different. And it could, number one, help the patient be healthier. But number two, could end up saving the state money in the long run. And as much as we like to think that you and I are, I mean, we are driven by our care for people and wanting people to have better options. People who work on state budgets are driven by state budgets.
Yep.
They're not driven by, well, let's just throw the money in just because I have a kind heart.
Right.
That just doesn't land. You got to make the case and show the proof that this could actually help on the budget side, or significantly improves public health in a way that's worth the investment. So that is really interesting. And New Mexico is taking some small strides in this direction, correct? So Oregon's program opened 3 years ago. Colorado has a program that has just recently opened. New Mexico's program has not opened yet. But what's the difference that you're seeing in New Mexico from the Oregon and Colorado programs?
Yeah, so I'll start with the differences between Oregon and Colorado. So Oregon, licensed and regulated, used for people over the age of 21 without qualifying conditions, right? Colorado also has that, but also has a full decriminalization component separate from that as well, right? So there's a lot of additional protections and removal of criminal penalties, not just for personal use, but personal cultivation, community sharing, etc. Colorado also has a slightly expanded licensing regime that I think Oregon would be smart to look at. They have micro licensing as well. So, which is just basically a fancy way of saying like a cheaper license for like a smaller kind of footprint. And so those are the primary differences there. New Mexico, historic for several reasons. Oregon and Colorado both passed via ballot measure. Very important. New Mexico
not through the legislature.
Not through the legislature.
Ballot measure means bringing it straight to the people.
The people voted for it. That's right. Yes, in Oregon, Colorado, the people voted it in. In New Mexico, they were the first legislative body to ever pass a piece of psychedelic legislation creating a licensed and regulated framework. That is historic. That signals the momentum that has shifted, not gone away. It has shifted from the ballot measure as a vehicle for change to the legislature, right? And so last year I authored a report called the National Psychedelic Landscape Assessment. And that was one of the big findings from that report, is that the momentum hasn't gone away. I think a lot of people were, the Lycos MDMA, application was rejected. Massachusetts tried to pass a ballot measure and failed. And a lot of people who haven't been around for that long kind of threw up their hands like, well, we must be done. It's like, no. This is just changing. The federal government's going to continue to take its sweet time, whether we like it or not. And ballot measures are really expensive. And, we're still 2 for 3 on ballot measures. So like that's still a winning record last time I checked. The momentum is shifting towards the legislature. And that just means we have to be more strategic. We have to understand the differences and strategy for that vehicle. And boy, the people on the ground in New Mexico absolutely crushed the strategy. I mean, they not only led with healthcare clinicians, veterans, the indigenous community was involved in New Mexico as well. And they had real legislative champions. And so their program is different than Oregon and Colorado. This will be the first medical licensed and regulated program. So medical is defined, and how I define it is 2 different things, and it can be either or both. In this case, is both. So I'll spell those out. Medical on the first point is you have to be a licensed healthcare clinician in order to become a facilitator. This is one of those political compromise points that I think a lot of people are making, for better or for worse, to be able to be politically viable, right? So you add that, it adds strength. It takes some of the medical community, out of the opposition camp and either to neutral, if not soft support. And it does add some level of credibility. The big question about that is how much, not if, in my opinion, not if that's going to make access more expensive, but how much more expensive will it be? And how many licensed healthcare professionals are going to raise their hand to be a part of this program? TBD. I think it's going to be a decent amount. It's going to be interesting once they get started. The other aspect
because in Oregon, you don't have to be a doctor or a nurse or something like that. You do have to go through many hours of training to become a licensed facilitator for psilocybin therapy, but you don't have to have a medical degree
That's
of
correct.
some sort, which is the difference in New Mexico. You do have to have that on top of then going through the training for becoming a
Yes, and to be clear, they are still in their rules and regulations process. So that is the statute. Now, there may be evolutions from that have some more flexibility, but generally speaking, it'll be medical practitioners of some degree and some background have to be the facilitators, right? So there's pros and cons to that. The other side of the medical aspect is from the patient perspective, which means in New Mexico, you have to have a qualifying diagnosis in order to potentially have access, right? In Oregon, it's you're over the age of 21 and you can't have these couple of things. If you do, you're out. If you don't have them, you could potentially move forward. In New Mexico, it's specific qualifying conditions. I don't have them in front of me off the top of my head, but I believe they're PTSD, depression, anxiety, like some big ones. So it's still a decent pool. But at the end of the day, I hope that they can continue to expand that, and we can get to a place of an Oregon model that says, look, if you have severe depression or you're interested in, psilocybin therapy for spiritual and, just general wellness and self-exploration, like, who is the state to decide, right? As long as you're covering the safety bases and you've got a licensed and regulated program, like you should be good to go. So that's the New Mexico program. And I'm really excited about it because the most recent development in New Mexico is that they have allocated $630,000 for a low income patient fund. Out of the gate, a legislature has said, we're not only going to create a fund, which is just a place to put money, but we're going to put money in it. We're going to put our money where our mouth is, right? Out of the gate. And so it's incredibly encouraging to see, states like New Mexico put their money where their mouth is, right? And it's going to be really interesting to see how the program goes, supposedly starting at the beginning of next year. That was another change that they just recently made in their short session, was they were going to have 2 years of implementation. They cut it in half, which is a big, bold move for a first of its kind type of program. But I applaud that effort. I love it. They've got a lot of really good hard work in front of them, but I get the sense that most of us aren't doing this because it's easy. We're doing it because it's important and it stands to have major impact in people's lives.
I was thinking about that actually about a minute and a half ago while you were talking. I just wanted to be like, how do you, what keeps you going? What is that fuel in the fire? Because gosh, you've been in this a long time and you've seen some great wins and also some crushing losses and wins that also have downsides. And, it just, what is that fuel that keeps you going? Yeah.
Well, I'll share a short, personal story. And I shared this at the Psychedelic Science Conference last year. My father has had a couple of near-death experiences, but the more recent one was a couple of years ago. He was sailing our family sailboat to Hawaii. We were going to meet him for Christmas in Hawaii, and he was sailing across the Pacific Ocean from Oregon to Hawaii by himself. No one was going to stop him. He was doing this thing. So we're like, okay, we'll meet you in Hawaii. And about 10 days into that event, we got a call from him on the satellite phone. Said, hey, there's really big storms picking up. I'm okay, but I'll stay in touch to let you know how things are going. And we didn't hear from him for another 4 days. On the second day, the winds had picked up to 100 miles an hour and the waves were about 40 feet. The Coast Guard went out and checked on him, and they're like, hey man, we're just checking on you. All the ports are closed because the weather's so bad. We can't get you in here, but we know you're here. We see you. He's like, I'm good. On the third day, they come out and the waves and the wind is even worse. And at that point, the boat had fallen over and the entire mast had broken. And the Coast Guard said, hey man, look, either you're coming with us or you're staying here because we're not coming out here again. And luckily he made the right decision of putting on his life jacket and jumping in the water and was pulled up in the Coast Guard helicopter. And 5 minutes later, the boat sank. And my dad is a Coast Guard veteran, actually, who has had other near-death experiences saving other people. Long story short, my dad has had a lot of trauma in his life. And like many men, and especially older men and veterans, has not sought to kind of work through that trauma. And for the first time in his life, my dad is interested in doing that. And he's interested in doing that through psilocybin therapy. The catch, he can't afford it. That's why I'm here. That's why I'm doing that. I want to finish it for everybody. I want to make it accessible for everyone that stands to benefit. But the truth is, I want to do this for my dad.
Love that. I think for everybody that's involved, maybe you get involved on an idealistic front, but if you stay involved, it is likely because you have relationships, people that you love, people that you've met along the way, who have had or need to have or want to have life-changing experiences to help them be better able to thrive and flourish in the lives that they have. So thank you for sharing that. That's I know a deeply personal story and reason to continue doing this. And I think it is for people who are upper middle class, it can be easy to forget that most people don't have $3,000 to go drop for some kind of treatment. On top of, if you live in Mississippi like me, then you need to travel to Oregon, and you got to stay there for several days, and you got to do. I mean, it is just it compounds, and so it is. I've heard so many people in Mississippi talk about, because we just passed a ibogaine treatment law, which we're super excited about, although it'll be years, and there's no guarantee that will result in ibogaine being accessible. But one of the things I've heard over and over from people is it's crazy that you have to travel out of the country to get this treatment, even if it doesn't help everyone, even if it's not the right thing for everyone, even if there's hard no's for previous conditions that you have, that it's not a good fit for you. Just because it's not a good fit for everyone doesn't mean that those who could benefit shouldn't have the opportunity to benefit from it. And when you bring it closer, you make it more affordable. And when you begin to make those decisions related to insurance and Medicaid and those kinds of things, you can bring it even closer and even more affordably to people who might be able to benefit the most from it, and that it becomes not a novelty for rich people who want to go do something interesting and different, but rather something that is just a tool in the toolbox that is then accessible for people who might be able to benefit from that. So where are you the most hopeful in terms when you look nationally? So you're seeing Oregon moved on it, Colorado moved on it, New Mexico's moving in a different way. But when people hear New Mexico, so in Mississippi, people hear Oregon, they immediately think blue state, very progressive.
Sure.
And they hear Colorado, and there's that's the wasteland where marijuana, changed everything.
Yeah.
Whether or not it actually is, we'll leave that for a separate discussion. And they hear New Mexico, and there's a blank in people's minds. There's wait, New Mexico? I don't know anything about New Mexico.
Yeah.
Is it conservative? Is it and I love that you've got a state like New Mexico where no one has any kind of preconceived, unless you're deeply involved in politics. You don't, nothing comes to mind when you think about what would be their angle. So I love that it's in a place like New Mexico. Love that they are, in some sense, I think I like the fact that they're trying something different, because it gives a different set of data on kind of, all right, what do we have here? And then we can begin to see what does happen to the cost when you medicalize a program, when you have qualifying conditions that you have to meet. And I think if you're not familiar with that kind of concept, it is like medical marijuana here in Mississippi. There's qualifying conditions. You can't get a medical marijuana card unless you have these diagnosed conditions. And if you don't, then you can't be part of the program. So in Oregon, you don't have to have a diagnosable condition. Now, what could happen, and what I think, again, we got to keep these buckets in our mind open about, is you could have where insurance might pay for it if it is for treatment-resistant depression, let's say, and they might not pay for it if it is just a spiritual experience you want to have to explore yourself. just because you have a program that is open to anyone who wants to take advantage of it doesn't mean that any particular Medicaid or insurance or whatever couldn't have specific things that they pay for versus not, just like they do for lots of other things. If you have any kind of medical condition, you're calling your insurance to say, hey, do you cover this kind of treatment? Do you not cover that kind of treatment? Some things they say yes, but you've got to have this particular diagnosis. Otherwise, we're not going to cover that kind of treatment. Right. So those are all options. If we can get our minds around this idea that we're talking about health conditions, we're talking about a tool that can be used as medicine for people to treat health conditions, we can begin to kind of get that into those boxes we're already familiar with in our mind that we just haven't really had a place for psychedelics before. And I say this as somebody who's never taken a psychedelic. I don't know what the experience is like.
Sure.
I'm very interested in people's experiences with it just because of how many people are suffering from long-term mental health challenges for whom there is not a great answer. Like, there's a reason people don't stay on their medication because they don't like the way it makes them feel. They've got terrible side effects. They've got all these different things. It's not just because they're saying, oh, I just hate medication. Like, there's reasons why people often don't want to take the medications that might help them be more stable from a mental health perspective, but they feel terrible.
Right.
So those are just all things I think that are just, we got to keep those in our mind and not just make these kind of quick judgments to, well, they should or shouldn't have access, or you should have this exact qualifying condition, or you shouldn't be able to access it. Well, if people believe that it might help them and they talk to a facilitator and they go through the screening process and there's a mutual agreement that that this could be a good thing for them, that should be something that people have access to, at least to pay for on their own.
Right.
But then that question about, hey, is this actually a good investment for healthcare dollars to be in is also there. So what are you seeing kind of nationally speaking? That was the beginning of my question. Then I went off on my own soapbox. Nationally speaking, what gives you the most hope? Where do you see traction? What are you excited about?
I mean, just the fact that the general conversation around psychedelics has continued to transcend partisan politics in today's highly partisanized environment is absolutely incredible, right? I'll give you a hot take. I'm not holding my breath on anything to happen to the federal government anytime soon. That's not a function of or a judgment on is there excitement in people talking about? Of course there is, and there's some of that is historic, and it's worth paying attention to that. Congress is still broken. Generally speaking, regardless of how many people are excited about it, right? So, I'm trying to really stay focused at the state level. I believe that states have the ability to provide more access at a lower rate faster than any federal program. That does not mean that federal change could not easily eclipse that if and when it happens, right? But I'm really trying to keep my blinders on at the state level because of the momentum that we're seeing. And I'll give you a couple of stats, right? So this is the big handful of stats that I got from the National Psychedelic Landscape Assessment, which anyone can go and download on the website cppolicy.org. You can download the full 130-page report. And basically in the last 5 years, 39 states have introduced well over 320 pieces of psychedelic related legislation, right? That's huge, right? That's the momentum.
The last how many years?
The last 5 years.
Last 5 years.
Yeah, well over 300 bills have been introduced in 39 states and the District of Columbia over the last 5 years. That's huge. That shows a lot of interest, and there's a lot of bipartisan, some of them are sponsored by Democrats. A lot of them are sponsored by Republicans, right? And I want to keep it that way. I want to continue to seize that momentum. I want to utilize the conversation of psychedelics to help I don't think psychedelics is going to solve partisan politics. Let me be clear, but it could help put a couple of Band-Aids on some open wounds that currently exist in today's political environment that the average, Joe of us out here, would really can we just stop treating each other that way? Let's continue to remember who we're working for here. Right. And I do think that psychedelics has a way to kind of navigate that in a way that very few other issues can. So generally speaking, I'm really excited to see a lot of the creativity. I'm not betting on any specific states right now, just because there's so many. And like, I'm trying to stay focused on one and getting the job done here in Oregon. And two, what I will say is that if you are in a state that has some type of active psychedelic legislation or are thinking about it, and you want help making a health economic case for that, reach out, email me, sam@cppolicy.org. Like, that is actually what I want to do. Oregon is the proof point right now, because I truly believe if we could do it in Oregon, it will have a domino effect across the country. And there are opportunities. We are seeing more bills pass, right? New Mexico is just getting started. Other states will start to pass their own regulated framework, and they're going to need to be able to make the case very early on. This is a worthwhile investment. That's the number one, reason that a lot of these bills don't pass. 330 bills now introduced, very small passage rate in terms of success, right? And that's not a negative thing. That's just a data point that we need to look into. And the number one reason why most of them aren't passing is because it comes with a fiscal note, which is how much a bill is going to cost the state. And if you can't justify that, ideally before your bill gets its first hearing, it's just a hearing. It's a feel-good hearing, which, like, maybe that's progress, sure. But like, let's not leave things on the table. We can make health economic arguments now with data that exists now. And if you're in a state and you want help doing that, please don't hesitate to reach out. That's what I'm really excited to do right now.
Yeah, that's awesome. And I encourage you to reach out, because that's how we met. Somebody told me about Sam Chapman, and I was like, okay. Totally. I'm never afraid to send an email, because I tend to think, hey, there's always people that know more about whatever the thing is. And there's people who have spent significant years of their lives doing a particular thing that might just be a small portion of my job, but has been their entire job for years. And my gosh, you've got people who know a whole lot and have amassed that wealth of knowledge and want to share it. And Sam is one of those people. So I encourage you to reach out to him. One thing, I want to know if there's anything else you want to share before we wrap up, but real quick, I wanted to go back to the integration piece and just close that out, because I think if people aren't familiar, they might think, gosh, you just go have this like experience, this is silver bullet, your life is fixed and changed, and you go home and like you're just a different person. So talk about the integration piece after somebody comes and has a treatment which can last multiple hours. With psilocybin, it tends to last multiple hours. And then what happens after their friend drives them home? What is that process like afterwards?
Yeah. So integration is arguably where the real work begins. That's not to say that an administration session itself cannot be challenging, if not one of the most challenging experiences of your life, right? But integration happens in a couple of different ways. There's the integration session, which is an actual meeting where you're following up with your facilitator to unpack the experience, to really share with that facilitator, what was that like? What came up for you? Have things changed? How do you feel? Why do you think you feel that way, right? They really help you unpack your own experience to help uncover insights that you may have not been able to understand in the experience. But as you invite yourself to really think deeply and sit with those things, that's where the learning and the work really starts to happen, right? And I mean, a lot of people say that psilocybin is simply the tool. You're in charge of using it, right? And so there's a lot of people who have done a psychedelic or a psilocybin experience and just like, well, that's all I needed. Like, I feel better, and they might for a couple of weeks. But chances are, if they're not actually taking the real time to sit with themselves and the experience, to journal about it, to share about it with someone who is trained to kind of hold that space for them. And that could also be a talk therapist too, that has experience in psilocybin facilitation, right? It's been shown that the effects tend to last longer when you can implement them into your day-to-day life, right? A lot of people really suggest, like, if you're doing administration on one day and integration happens a couple of days after, you should give yourself at least a couple more days before you can go back to work, if you can afford to do that. A lot of people can't, but like really giving your space to land again and have a soft landing, and not just plug right back into the machine that is your day-to-day work, all your responsibilities. And like, this is for you. And you have to give yourself the permission to be able to recognize that this thing might take some time. And the more time that you give it and the more intention that you give it, the higher the chances that you're going to continue to see benefits that last longer and longer. And so that's one of the important through points in integration that is often just kind of seen as like a follow-up. It's so much more than that. And arguably, again, like is just as important, if not more important than the administration session itself.
Yep. That's important. It's important not to just think, oh, miracle drug,
right,
or oh, silver bullet.
Yep.
I think if I've heard anything loud and clear from advocates who've worked in this for a long time, it is quit thinking about it like a silver bullet. It is not a miracle drug.
That's right.
This is a tool that can be very helpful, but what you experience and how that impacts you, a large part of that comes from the work you do beforehand to prepare for it, your intention and expectation and how you take it and the guides who are with you during that, and then how you integrate that process afterwards. This is not it's not a miracle pill or something that you take and it just, wow, I am all better. We are complex people, and this is a tool that's helping us maybe access some of those parts of ourselves that we struggle to or can't access without some significant help. And it offers a way of accessing some of those parts of us to be able to kind of see what's there and begin working through those things. Anything else you'd like to share before we wrap up? This has been super helpful. I so appreciate your time.
Yeah, no, I don't think so. I mean, I'll just reiterate that, if you're out there and you're interested in either getting involved or, again, like you're already involved and you want some help with something that you're working on, again, like I've got my eyes laser focused on Oregon and just general health economics arguments. But if you're putting in work on the ground and you've got questions, like please reach out. I'll do the best that I can to get back to you and provide whatever help I can, if not make connections or just answer questions and point you towards resources. Happy to do that. Super easy. And those small little things in great numbers can do big things over time. So that's another reason I'm happy to do it.
Yes, absolutely. Thank you, Sam. Thank you for your time. Thank you for your advocacy, for your investment of a lot of your career in this space where there's no guarantees. It's easy to look and be like, well, I mean, look what they did in Oregon. Well, like you said, there's a lot of advocates have been trying it in other places. Yep. and haven't been able to find the success yet. And so that there's no guaranteed success. It was not inevitable. There's people who are investing years of time and effort and learning and focus groups and understanding what legislators are looking for. And how do you create something that we haven't had in the U.S. before? It's not obvious how to do that best. It takes a lot of work. And so I'm really thankful for you and all of the other advocates that have been working to make that happen so that we can have 19,000 people who have gone through the program in Oregon and many more who will go through Colorado, New Mexico, all the other programs that will be starting around the country. And I hope in 10, 20, 30 years, everybody thinks of psychedelic assisted therapy is just as a normal tool in the tool belt that may be a good fit, may not be a good fit, just like a SSRI may be a good fit, maybe not a good fit for somebody who's struggling with depression or anxiety. And we just have more tools in the tool belt to help more people be able to live healthy, thriving lives. So thank you.
Yeah. Takes a village. Always has, always will.
Yep. Thanks for listening to the End It for Good podcast. Join us for the next one. We've got some really fun things coming up. And so we'll see you next time. And in the meantime, head on over, check out Sam's work. We'll have all the links in the show notes. Reach out to him if you're working in the advocacy world. And we hope to see what I'm always hoping for, because I live in Mississippi. We hope to see something like this in Mississippi in the near future, because we want to be on the front end of things that can help more people build healthy, thriving lives. Thanks for listening, and we'll see you next time on the End It for Good podcast. So how do we shift our drug policies from a criminal justice approach to a public health approach? By inviting one person at a time to change their mind. Changed minds are the catalyst to changed laws. But many people are only willing to have this conversation when they're invited to by someone that they trust. That's you. Invite your friends, coworkers, other people in your circle of influence to consider a better way. At End It for Good, our hope is that people who hear will become people who tell. Start a conversation and join the movement to end it for good.